Hi everyone, I wanted to come on today to talk a little bit about something that I'm super passionate about, which is appropriate abdominal bracing. So controlling your intra-abdominal pressure when you're weightlifting. This is a huge issue for female athletes in particular. I hear all the time that women say, I went so hard I peed my pants. Not okay. And we see a lot in female athletes that they are having incontinence when they lift. That's a sign of your pelvic floor failing. And it's typically due to the fact that we're not bracing appropriately. So let's take a little step back and actually look at why this is important and what we need to be doing. So the reason that we brace for a lift is that our lumbar spine is inherently unstable, right? We have a lot of movement in there. And so when we go to lift, what we don't want to have happen is that we're rounding through the back and using our back to lift, right? That's how injuries happen. We see disc herniations that way, amongst other injuries. So what is happening when we brace is we're increasing the pressure of that abdomen. I like to use the analogy, you've probably heard this by now if you've been following along with these posts, of our abdomen being a tube of toothpaste, right? So we don't want to think about pressure going downward. If that tube of toothpaste is capped down here and the base up here, if we increase that pressure and the pressure goes downward, what happens? Toothpaste comes out, we leak. Women have an opening for the vaginal opening in the pelvic floor, so things can prolapse down. We also are more inclined to develop urinary incontinence with inappropriate pressure regulation. Now, men can also develop it. It tends to present more on the other end of the spectrum, so fecal incontinence, which obviously we don't want it either. So what an appropriate brace would look like is first finding appropriate transverse abdominis engagement, getting that deep muscle that wraps all the way around to contract and lock in. So then we have this strong, stable canister which we can push against. Oftentimes people use the cue when they're lifting with a belt to push against the belt. And I like that cue only if we have TA engagement going on underneath that. If we don't have any of that engagement going on, well, guess what? Things are not going to be able to be regulated from a pressure standpoint. So remember that TA wraps all the way around and it needs to be engaged so that you have something to push against and that diaphragm dropping down as we inhale the brace isn't pushing down against the pelvic floor. So what does that look like? Let's say I'm setting up for a lift, and of course I'd be bent over a little bit more, but we'll take a couple of really good breaths. With each exhale, I want to think about engaging my TA a little bit more. So I'll show you what it looks like when we're doing it correctly first. So we're bent over here, inhale, exhale, navel to spine. One more time, breath in, exhale, get deeper. Now, I've got this tiny little volume in my abdomen, and I'm going to take a big breath in and push against that. And I feel that pressure go outward. I'm not feeling that pressure go down against my pelvic floor. Now I've got a strong, stable abdominal cavity to lift against. Something that I often see, which is not horrible, but it's also not correct, is over-engagement of the obliques and not getting any TA. So remember, when we engage our obliques, we get this kind of a little bit of a posterior tilt, your ribs move a little bit. So that's fine, but you can also see what that does. I want you to watch my belly, my lower belly actually pushes out when I do that. So in an oblique engagement, you see that my lower abdominals popped out. This locked in, this popped out. And so that's not what we want to have happen because obviously now there's more pressure lower rather than engaging TA where we're lifting up and in. All that pressure comes up and away from the pelvic floor. Now here's what it looks like when we're really not doing it right. So I'm bent over, I've got my tummy totally relaxed, and I'm actually going to lower my waistband down so you can see this. If I were to push down or bear down, my tummy just pushes straight out. Now I feel stable, I feel that pressure outward, but I feel it big time in my pelvic floor downward, which as you can see would increase the likelihood of developing something like incontinence or pelvic pressure. So if you're somebody that experiences any sort of leakage under heavy loads, or if you experience pressure during or after a workout, chances are you're not actually bracing your abdomen appropriately. So what I challenge you to do is just start to engage TA, so thinking big breath in, exhale, drawing up and in, and holding that in. So we're really feeling that tension low, but a pulling up type engagement. Try doing that before you brace for your lifts and see if that gives you any sort of change in terms of that pressure. Thanks so much for watching, guys. If you have any questions about that, please don't hesitate to leave me a question below, because I am super passionate about this and could talk about it for hours. But hopefully that gives you a little insight into what we need to be doing. Have a great day.